Good morning students. Today we'll continue with the question paper. As you know that we finished our multiple choice part of the question paper. So there are, I already told 75 marks. So the next one we'll continue with differentiate between. It's also a part of the question paper. So differentiate between, today we'll see differentiate between hyperplasia and metaplasia. What is the difference between hyperplasia and metaplasia? Okay. Don't miss all these classes or the revision question classes. So today we'll see the difference between hyperplasia and metaplasia. So first we'll deal with hyperplasia. So what is hyperplasia? Hyperplasia is the increase in the number of cells in an organ or a tissue. Increase in the number of cells in an organ or a tissue which makes which causes increase in size of that particular organ or a tissue. Hyperplasia is nothing but it's the increase in the number of cells of an organ or a tissue which leads to increase in the size of that particular organ or tissue. Very easy actually. Second one is why there is the increased number of cells occurs. It can be due to increased rate of cell division or proliferation. Okay. So what is proliferation? Proliferation is nothing but it is the cell grows and divide to produce two daughter cells. Okay. So it can be due to why this increased number of cells. It can be due to the increased rate of cell division or due to proliferation. And this hyperplasia can be both physiological as well as pathological. Physiological in the sense that there will be increase in the breast tissue. Increase in the breast tissue during the time of pregnancy, that is physiological. Pathological is that increased cell proliferation of prostate gland in case of benign prostatic hyperplasia. So it can be both physiological as well as pathological. And why this hyperplasia occurs? It can be due to hormonal changes, it can be due to increased functional demand of the body, it can be due to chronic irritation. Okay, all this can lead to hyperplasia. Okay, so there are 3-4 points, and usually the marks will be of 2 marks. Differentiate between hyperplasia and metaplasia. The mark might be for that question be of 2 marks. So you should write minimum 4 points of each. Okay, I will repeat once again. Hyperplasia is the increase in the number of cells of an organ or a tissue. This increase in the number of cells can be due to increased rate of cell division or proliferation. It can be physiological or pathological. Physiological is that changes or in the breast tissue during the time of pregnancy. Pathological can be due to the cell proliferation in case of prostate gland, which leads to benign prostate hypertrophy. This increase in the number of cells can be due to 2-3 reasons. First is it can be due to hormonal changes, it can be due to chronic irritation, or it can be due to increased functional demand of the body. Okay, so you just revise this. Okay, revise the points of hyperplasia. So today we have already seen what is hyperplasia, isn't it? So hyperplasia I have explained, and the question is differentiate between hyperplasia and metaplasia. We have seen what is hyperplasia. Now we will see what is metaplasia. Metaplasia is cell transformation in which one type of mature cell is converted into another type. Is it clear? One type of mature cell is converted into another type. I'll give you examples. For example, ciliated columnar epithelium which lines the bronchi is replaced by squamous epithelium in those people who are heavy smokers or they are chain smokers. In those people, the ciliated columnar epithelium is converted into squamous epithelium. So you have seen one example of metaplasia. I will give you one more example. That is the normal squamous epithelial lining of the lower esophagus is replaced by columnar epithelium in patients who is having chronic acid reflux. Okay, and that condition is called as Barrett's esophagus. So I'll repeat that example once again. In metaplasia, as you know that one type of mature cell is converted into another type. So here in the Barrett's esophagus, what is happening is that the normal squamous epithelial lining of the lower esophagus is replaced or converted into columnar epithelium due to chronic acid reflux. That condition is called as Barrett's esophagus. So now you might have understood what is metaplasia. Metaplasia is one type of cell is converted into another type. Okay, is it clear for you? Okay. Okay students, it's time for conclusion, or we can summarize what all things we have studied today. Okay. Hyperplasia, the question is differentiate between hyperplasia and metaplasia. So hyperplasia and metaplasia. In hyperplasia we will see increase in number of cells in an organ or tissue leading to increase in its size. Whereas in metaplasia it is a reversible change in which one mature cell type is replaced by another mature cell type. Okay. In hyperplasia, increase in number of cells in an organ or tissue leading to increase in its size. Metaplasia, it is a reversible change in which one mature cell type is replaced by another mature cell type. Second point, change occurs in response to stimuli such as hormonal changes, increased functional demand or chronic irritation. Here, change occurs in response to stress, inflammation, chronic irritation. So, we will see the examples. Examples for hyperplasia is increase in breast tissue during pregnancy, it's a physiological change. Then proliferation of cells in prostate gland in benign prostatic hyperplasia, it's a pathological change. So, can be of physiological as well as pathological. Physiological change example is increase in breast tissue during pregnancy, and pathological change is proliferation of cells in prostate gland in case of benign prostatic hyperplasia. In metaplasia, the examples are change of ciliated columnar epithelium to squamous epithelium in response to severe smoking. And second example is normal in Barrett's esophagus, normal squamous epithelium is replaced by columnar epithelium in patients with chronic acid reflux. And the other term for this is Barrett's esophagus. See, you all might have heard in the video what all things is this, and I have explained it properly. Go through the video, study properly, write your exam, you will get very good marks.